In this segment, we're talking about the most common diagnosis of shoulder pain. We're just going to talk about one. There are many others, but by far the most common diagnosis is called a rotator cuff tear. Okay, it sounds really scary, a tear. There's different grades of tears and different categories. The two main categories are a partial tear, meaning that where the muscle turns into a tendon and the tendon attaches to the bone, that tendon has torn slightly, partially. The other end of the spectrum is called a complete tear, where the tendon has completely torn off of the bone. All of those sound really scary. The symptoms of a rotator cuff tear is, again, pain in the shoulder. Sometimes it travels down the shoulder, nighttime shoulder pain, and then more often than not, when we lift our arm overhead, that can oftentimes increase the pain. There's 4 muscles that create the rotator cuff, okay? And you can see how little they are. And I want you really to pay attention how they come from the shoulder blade, and then they wrap around the head of the humerus, or the ball. It's a ball and socket joint, and you can see how they wrap around that ball. But pay attention to the top of the roof, I call it, of the rotator cuff tendons has a bony roof that is actually part of the shoulder blade. And so as the shoulder blade is moving, it has to move in the exact same direction and speed as the arm bone or the humerus. Otherwise, the space in between that bony roof and the ball gets compressed. And that compression, if that's there long enough, starts to fray those tendons and can cause a partial tear or a full tear, a complete tear of the rotator cuff. Now, here's the thing. It sounds really scary. Oh my gosh, I have a rotator cuff tear. Well, I'm going to go through a study real quick. 2013, there was a study, the Journal of Orthopedics, where they looked at thousands of people on an MRI that had no shoulder pain. A huge amount of people without shoulder pain, they looked at an image of an MRI. And what they found is pretty fascinating. So they found that the 50-year-olds in the group, 50% of those people that had no pain had a partial or full thickness tear in their shoulder without pain. Then they went to the 60-year-olds and they found that 75% of 60-year-olds had a rotator cuff tear in their shoulder as well, without pain. So that means that there's hope. It means that the body, if given the right environment, is able to heal itself naturally and without medications, injections, and surgery. And essentially the body heals itself. The inflammation goes away because it's the second phase of healing, and then the pain goes away. And the body basically just heals itself by creating some scar tissue, and then life is good. So we know there's a lot of hope. That is by far the most common diagnosis of shoulder pain. But the reason I'm highlighting that and then also the studies is because that is not the cause of the shoulder pain.